Right. Well, thank you guys all for calling in today. I really appreciate it. I hope everyone, I feel like the weather, at least here in California, has cooled down a lot. So we're not melting like we were before. But yes, thank you for being here. And I think a lot of you know who I am. I think a lot of these people on this call I recognize. So, but I know some of our panelists also invited people as well. So I just want to thank you guys for being here today. My name is Taun Hall, and I'm the Executive Director of the Miles Hall Foundation. And so glad you could be here today to share space with us in our Strength and Healing panel conversation today. So July is BIPOC, Black Awareness, Indigenous People of Color Awareness Month. And we need to give thanks to Bibi Campbell Moore, who was a strong advocate for mental health awareness in Black communities. In 2008, her hard work paid off, and U.S. now recognizes July as a month that highlights the things that people of color, to show that people of color have different mental health disparities than other groups. But I personally wanted to host this meeting to bring awareness to the gaps and continue the work of breaking the stigma around mental health, promoting cultural appropriate care, and discussing the unique struggles our communities face. There are mental health disparities, and BIPOC adults are less likely to receive the care that they need because of the deep-rooted disparities that are in our system when seeking care. As we know, there are disparities in the criminal justice system. We need to recognize that racism attributes to these disparities. The lack of trust in government, healthcare, and other social systems discourages Black people, BIPOC, from seeking help. We also need to hold space to recognize that Black, Indigenous people of color have been treated unfairly throughout history. In 2019, my son, who was 23 years old, was killed by the police in a mental health emergency. Unfortunately, getting someone help who has serious mental illness is a very reactive system. You have to be a danger to yourself, danger to others, or gravely ill. Our family was proactive, and we made sure our neighbors and even the police knew who Miles was. Because he was knocking on doors, he was having delusions and hallucinations, he thought he was Jesus. So while Miles thought he was Jesus, and we realized he had schizophrenia, and which is as we know, serious mental illness is best treated with medication. So Miles needed professional help. He needed care, compassion. He needed someone who was going to react to him with love and care, and someone who understood someone in a mental health emergency. But that was not the case. And the officers that came to help Miles, as we thought, they came with guns and they killed him. So we need to have professional people who have the right education and understand and have a compassion, and also will come and de-escalate. When Miles was killed, our lives were shattered. Now our family and friends lost the sweetest soul. He was so kind. He liked to make rap beats. He saw the best in people. Some of his family even friends and family called him Smiles. He was an incredibly happy and loving person, and he should be here today. And his mental health should not have been criminalized, but it was. So in the midst of our loss, my husband Scott and myself and our family, we started the Miles Hall Foundation so this would not happen to another family. So we now have a 501c3, and we were working really hard to make sure that this doesn't happen. A study conducted by the Treatment Advocacy Center found that people with mental health emergencies are 16 times more likely to be killed by police by police in an encounter with police. We also found that 1 in 4 police shootings involve someone with mental health emergency. Many of you might have heard about Ryan Gaynor. He was an autistic 15-year-old who was killed in San Bernardino County back in March. He was autistic, he was neurodivergent. Their family needed help with Ryan, and they called 911, and instead of them coming with care and compassion, they came and they killed him in front of his family. So we also want to make sure that people on this call know that there's other ways to get help besides 911. There's now a phone number, 988. Also, I'm sure you guys have seen the horrific video of Sonia Massey, who was just gunned down in her own home when she called 911 for help. She called saying there was a prowler outside, and and I don't understand how the police ended up in her house shooting her. Her family said she also had schizophrenia. So we cannot have these reactions from police because they cannot be the first responders. Rania, Sonia, and Miles were not criminals, but they were treated like criminals and had a criminal response. Families like mine have trauma and need an outlet that addresses racism, police violence, and mental illness. The mission of the Miles Hall Foundation is to advocate for individuals and families affected by mental illness, educate communities to reduce stigma and bias surrounding mental illness, and prevent criminalization and excessive use of force by law enforcement in mental health emergencies. This year, the Miles Hall Foundation created a 12-week free group program, and we are going to also have another one this year. So we're going to talk more about that later. But first, I want to introduce our panelists. We have Dr. Jason Outlaw, Stefan Dent, and Dr. Lauren Matlock. And they're going to be here to talk to you more about mental health in the BIPOC community and also answer your questions. So I'll go ahead and kick it off to Dr. Outlaw. You want to go ahead and introduce yourself?
Taun, I appreciate you inviting me to this panel. Certainly your story is one that unfortunately touches many lives, and many other people have also experienced what you did. So I applaud you for starting the foundation, and of course, keeping people talking about mental health, specifically severe mental illness, as it gets overlooked many times. My name is Dr. Outlaw. I'm a psychologist here in California. I'm born and raised in Oakland. I have lived in a couple different states, but decided to come back and practice in my own community once I became licensed. I own a clinic, a virtual clinic, which of course everyone understands that the virtual world of treatment has become more and more popular. Access to it has become easier. And so Journey of Life is the name of that clinic. We accept a bunch of insurance companies as well as Medi-Cal, Medicare, et cetera. And then I also have a second clinic that's an on-ground clinic in El Cerrito that is for intensive outpatient and partial hospitalization. So I'm sure we'll talk a little bit more about what each of those treatment modalities are if you all haven't heard of them, but it really does kind of target some of what we're talking about and provide an outlet for a higher level of care. But I'm happy to be here, happy to be a part of the panel, and thanks everyone for joining.
Thank you so much, Dr. Outlaw. I appreciate you being here today. All right, and then if we can have Stefan, you want to introduce yourself, please? Stefan Dent.
Good evening, everyone. Grateful to be here. My name is Stefan Dent, raised in Oakland, California, / Berkeley. I'm a certified life coach and mental health facilitator, 17 years in the field. I had an adverse childhood that propelled me towards my life mission with giving back to my community and individuals that look like me. My mission is to help facilitate and pour into individuals that don't have the necessities to actually combat or navigate specific barriers that prevent them from being their true authentic self. So I've been doing that for 17 years, and I'm grateful to be here. So thank you for having me.
Thank you. Thank you so much for being here today. And last but not least, we'll have Dr. Lauren Matlock. Introduce yourself.
Hi, good evening, everyone. I'm Dr. Madlock. I am not a native Californian. I'm actually native to Memphis, Tennessee, which is where I currently reside. But I spent several years living and practicing in the Bay Area and Oakland and the East Bay, further out in the East Bay. I am currently in private practice and serve a wide range of adults here in the Memphis community. I am also facilitating the BIPOC trauma and support group, 12 weeks, that has been so graciously coordinated, not only hosted, but funded through the Miles Hall Foundation. And I think that that's been a very wonderful opportunity. And I certainly hope that the folks who have been fortunate enough to participate think so as well. I have specialties in working with folks who are trying to conceive, who are experiencing some reproductive challenges in general, and who might be postpartum. And that can be individuals, couples, etc. But I'm really, really happy to be here with you all this evening.
Well, thank you. Wow. As you can see, we have an amazing and impressive group. So thank you guys for all being here today. So as you know, I'm going to be asking you guys a couple questions that we've kind of prepared beforehand. But if you guys have questions on the panel, I mean on the web, you guys can go ahead and put them in the chat, and I will definitely save some time to answer some of those. So, Dr. Outlaw, I'm going to first start with you. How do you know when a mental health issue becomes a mental illness? And then what are the most common contributive factors to mental illness?
Sure.
That's kind of a two-part.
Sure. Well, we're really resilient as human beings, both physically and emotionally, meaning that we can endure a lot. Even when you talk about kind of a trauma sort of experience, human beings are constructed in ways that we can endure a lot and still kind of continue. However, at the emotional level, certainly there are some things to kind of think about when you want to consider, hey, has this become so significant that I need to kind of consider additional resources and additional help here? And there's a couple of things you want to keep in mind. One is your behavioral response, right? And so if your behavior has started to become very different than what was quote unquote normal for you, and or the behavior has become neurotic or a little bit outlandish, right? And many times friends and family tend to kind of have concerns in that area. That's, of course, something to kind of consider. Your emotional response as well. So we as human beings, we're supposed to feel anger. We're supposed to feel sadness. We're supposed to feel excitement and all the different emotions. No one is saying that any of the experience of those emotions is abnormal. However, if they are so significant to the point where you find yourself having debilitating depression, or you find yourself so angry and upset that you can't experience love, that's certainly an indicator as well. Also looking at sleep, oddly enough, your sleep is impacted many times by mental illness or mental health concerns. So if you're experiencing hypersomnia, which is essentially oversleep, right? I have a client that I'm working with right now. She can sleep up to 16 hours a day, which is not normal. Or insomnia, which is not being able to sleep. Or even if you sleep, it doesn't matter if you got 8 or 10 hours of sleep, you still feel exhausted. That is an indicator as well. Appetite changes. Many times we see correlations with how much one is able to consume in terms of food and their mental health as well. Many times people don't have an appetite at all, particularly if they're experiencing a major depressive episode. Also, socialization changes, right? So if we're looking at someone who's isolating themselves, or on the opposite side of that, sometimes we socialize in an overabundant sort of method, and that sometimes can be an indicator as well. Maybe we're looking at socializing as a addictive sort of piece there, and there can be some concerns there as well. And also just kind of decompensation, right? So specifically, if we're talking about severe mental illness with any sort of thought disorder, we see that an individual stops caring for themselves in terms of hygiene, right? You're noticing a lot less showering, a lot less toothbrushing, anything in reference to to one sort of general sort of hygiene. You see some concerns there. So this is not a comprehensive list. I don't want to give this as a comprehensive list, but these are some areas that you might want to think about, and they're very common. Now, them in isolation, one or two, and they're not so significant, maybe through support that you have with loved ones, you can kind of get over the hump and get yourself back to previous level of functioning. But if you find yourself really struggling in any of those areas and not seeing any relief, then my recommendation would be to consider what other resources might need to be put in place so that you can, quote unquote, return to previous level of functioning. That's kind of a fancy phrase we use that kind of looks at where people were, where people are, and where they need to be. So that's the answer to that first question. I'm sorry, I'm blanking on the second part to that question.
Oh, yeah. It was, what are the most common contributive factors to mental illness?
Okay, so in terms of contributing factors, there are several, and we kind of need to separate both kind of general mental health and severe mental illness. And so with general mental health, I kind of consider that's the larger portion of the population who needs mental health services and kind of fit into this. So maybe there is a depressive episode, maybe there's some grief and loss, maybe there's couples work, maybe there's family work, maybe you're also just going through some stress at work, right? And so in terms of separating the two, we got to be able to see the two in a dichotomy to really kind of understand contributing factors. So in terms of general mental health, certainly just regular stress, right? And so we all inevitably are going to experience stress. That's not going to go away. But if you have multiple sources of stress and they're all kind of starting to impact you at once, you are certainly at risk. We're talking financial concerns as well. So if you have some financial concerns and it's really starting to impact you in ways in which it hadn't in the past, you want to think about that as well. Relationship concerns, I kind of look at like the major three pillars being relationship, financial, and occupation, right? So if we have more, even if we have one of those, but certainly if we have two or more impacts in those areas, we're certainly going to, everyone is going to be impacted. Doesn't matter how resilient you are, doesn't matter how strong you are, doesn't matter how many books you've read, you are going to be impacted and you might reach that threshold of kind of needing more. But in terms of contributing factors to a severe mental illness sort of case, we have genetics, right? And so not always the case, but certainly we see a strong link between family and the individual with SMI, with there being an even stronger link from the same gender, right? So parent to child, we're talking father to son, mother to daughter, a stronger component there. It doesn't mean cause and effect. It means correlation. Certainly substance abuse. I've seen, not many, but I've seen several cases where there was no genetic component, no family mental health history, but the individual was experimenting with some pretty harsh sort of drugs, and there can be a substance-induced sort of thought disorder or a case there. So you got to be careful with that, of course. Contention. Here's one that I've recognized recently. So in my partial hospitalization program, we kind of do a little bit of a round robin and asking kind of what's going on. And one thing that I've noticed, not a huge surprise, but if there is a contentious relationship with one or more of the parents, that puts an individual at risk as well. That doesn't mean that you're going to have schizophrenia or schizophreniform disorder or anything else because of that, but it can certainly put you at risk. On top of economic inequities, on top of social deprivation, on top of some other factors, but those are kind of the main contributing factors to it as well. I did read an article not too long ago that even suggested, and it was a peer-reviewed article, it even suggested that the time of year in which you are born has some strong sort of research base behind it that has to deal with kind of if individuals develop SMI or not. And I kind of thought that was a little different, but clearly they've done the research there. But I can talk on and on, so let me stop here. But those are some of the major contributing factors to both general mental health as well as SMI. Thank
you. No, I appreciate you, kind of laying that down for a lot of people who may not even realize, like, oh, like especially for Miles, like, we saw that behavior. We saw the changes in his behavior. So it is important that families really pay attention, when someone maybe starts isolating more and all that. So we definitely saw some of that as well. So thank you for sharing that. Now we're going to go on to Stefan Dent. Stefan, I know you're coming from family systems and educational perspective as a life coach. Can you tell us how you see mental health issues in young people, and also perhaps how family members can be supportive to relatives if they have mental health challenges? So like, how can you support someone with mental health challenges?
Yes, so thank you. So first off, you just want to pinpoint mental health can happen in any individual at any stage in their life, from epigenetics to childbirth. If the mother was experiencing a lot of stress during her conception, that child will have that same emotional, trauma that the mom experienced during her 9 months. So we have to keep that in mind as well. So over a factor from birth to 7, that's when a child is being programmed into being conditioned into the mindset of the parents, of the environmental. So all that programming is not them, it's the behavior that the individual has been receiving from birth until 7. So that's their programming. So outside of that, that can also contribute to mental health issues and things of that nature. So for family members that aren't that aware of mental health resources and things of that nature, getting themselves familiarized with the specific trauma responses or the triggers of their loved one, understanding the dichotomy, the background, and things of that nature, or also taking accountability on their contribution towards either a specific negative viewpoint or mindset. For example, we as Black people or African Americans, another factor for us to have, trauma on top of us is the labeling of Black people being second class, not good at specific things, not good at math, English, things of that nature. So we're already entering the world with a negative viewpoint on us that's contributing to the environmental and biological factors on top of that. So once we grow into adulthood and start an adult relationship, we've already been programmed twice already. Not seeing the fact that a person, is trying to identify with a false label that was given to them from either their parents or their siblings or their friends, them showing up to the graduation and receiving their diploma, or is that specific person really seeing themselves as worthy of accepting this diploma and going into this career field 100% present? And 9 times out of 10, us as Black people were not, because the contributing factors, is deeper than the fact. So family members being how can I say, being open and willing to actually look at their contributions towards the trauma and the abuse towards their family members, and taking the necessary steps to be conscious and actually watch the behaviors, the subtle cues, the nonverbal reactions, and being conscious of what they say so they won't actually trigger that person to go AWOL.
Right.
Yes, so.
Yeah, no, that's great. Yeah, thank you. So it sounds like what I'm hearing you say is just there's a lot of the contributive factors, right? It's the underlying things that are happening in your childhood, and it's kind of going back to that child. And yeah, so thanks for sharing that.
You're welcome.
Yeah, and then now we're going to go to Dr. Madlock. So in your experience, are there specific mental health issues or concerns that are particularly frequent within the BIPOC community? And then how are those better just addressed with a BIPOC therapist?
Yeah, I think the most kind of prescient thing that stands out to me is this idea of race-based trauma. And that can look like any number of things. That could be I hate to call it slight, but right, the kind of the slightest of like day-to-day experiences that in the moment, but certainly compounded, that is repeatedly and over time can really have an impact on us. It could be someone commenting on your appearance or asking you a question about how you came to share space with them, right? All sorts of things. It can go right as severe traumatic as encounters such as yours, Taun, right? Where then we encounter police sanctioned violence and things of that nature. So I think a unique experience to folks of color is a wide range of race-based trauma. And again, that can happen in numerous ways. And really, they're called microaggressions, but they really erode at us over time. So I don't think they're to be taken lightly. I think along with that, right, the ideas of that either, and I want to say we can hold them, but certainly that others hold about how we exist and move through the world, whether we feel like we're conditioned to take on more, the Superman, superhuman complex, in ways that we can, again, resiliency was spoken to, but do we find ourselves practicing or trying to show up as more resilient than maybe we should be in a circumstance or that we actually are? I think that can be unique to folks of color. It also can, from white folks or non-BIPOC folks, really kind of give us the sense that we are indestructible. I think that can, take away from like our overall sense of humanity. So that kind of stands out as like, I think specific experiences that can lead to impacts on our overall mental health and well-being. I do think that even more common, if you will, diagnoses present different in folks of color. And I think things that we might have thought of as tropes or stereotypes can often be symptomatic, like, irritability in a Black woman might just be an angry Black woman, right? But irritability is a hallmark of depression. And I think how some of these symptoms show up and then are perceived by others. So I don't know if it's more so, is it more prevalent or more common, but how it's seen and then, so recognized, diagnosed, and then treated can look very, very different for folks of color. The second part of the question, remind me.
Oh yeah, the second question was, right. How do you, as a BIPOC therapist, address them? Which I think.
Yeah, I think there is. I think some of these factors could be, and I'm not going to speak in a definitive nature, but I think could be better held, validated, understood by a BIPOC therapist. We know through eons of research that goodness of fit within the therapeutic relationship makes a tremendous amount of difference. That is, right, the fit, the match between client or patient and therapist has tremendous impact on the outcomes in therapy. And so I think there becomes an added challenge when folks of color are attempting healing under that same white gaze. And so not to say it's impossible, I think it's an additional like challenge or barrier.
Right. Okay. Thank you. Yeah, no, I think, yeah, when someone understands, maybe some of the struggles that you're having on a different level, right? Culturally, it really does make a difference in how they can relate. Like for me, when I was starting to do some therapy myself, I had a really hard time because I wasn't in the right room, right? I wasn't in the right group because I was with people who hadn't experienced trauma like I had. So while we've lost a loved one, it was very different the way we lost them. So it's like when you understand and you're in the right when you're with people who understand you and like what you've gone through. And that's why group therapy is super helpful because you have that back and forth of people who understand and you can share your experiences.
Absolutely.
So yeah. So I'd like to ask, I'm just going to ask this generally to all of you. But what are some external and internal barriers to accessing mental health care for BIPOC communities, and how can we overcome them? So, like, what are some of the external things that are, that make it hard to get care?
I'll start. I would say the two things kind of come to mind for me. One is access to care, right? And so it's not only the obtaining insurance and having insurance that would cover it, but it's also, as we just kind of described a moment ago, having access to a therapist that you relate to, that understands your worldview, that understands your unique presentation. And I'm quite sure my colleagues on the panel would agree that we're all overworked these days. Like it's hard to find an opening. Sometimes clients will contact me in my office and they're begging for an opening and we just don't have it. Just because, I mean, this is a partially a benefit to the field. I think stigma reduction has started to happen. I think with the pandemic, people start talking about mental health. And so, and plus telehealth work, with being able to do therapy at home, has just kind of opened up the door for a lot more people. But that's certainly one. And then also, I would say understanding your health insurance. And so when you kind of consider what health insurance to purchase, sometimes there's like the bronze, silver, and gold package, and they come with dollar amounts, right? And in those dollar amounts, everyone wants to pay the least amount, right? But if you don't understand that there's an inverse relationship between premium and deductible, meaning if you choose a plan that has a low monthly premium, your deductible is going to be high, right? And so, but even within that, now you got to understand, all right, I already know that I take advantage of mental health services. So I want to choose a plan that I know has outpatient mental health services. So to be able to read through the health insurance benefits is hugely important. And it's written on purposely like Greek, so that if you're not in the healthcare field, you're going to struggle with that. And now you're left to choose one that fits your budget. And then when it's time for you to get services, you may be at a disadvantage there. So I would say those two pieces stand out to me most in terms of the questionnaire.
Yeah, no, thank you. No, that's super helpful. I think you put in context of the disparities that are there, right? And not even understanding your own health insurance I think is a big one too. Yeah. So I don't know if anyone else had something to offer as well about the external and internal barriers that we have.
Yeah, I mean, top of mind, certainly it's just like this idea of access, but outside of like, right, financial access, like the other resources we have, time, like therapy is an investment of all sorts, right? Like even when I think about group, right? It's 3 months, an hour and a half, on a weeknight. And so do you have the time to commit to that? So it's money, it's time, it's energy, it's accessibility to spaces that feel safe. I mean, it's all sorts of resources that I think we don't really think about, and we can take advantage. Yeah, we can just kind of miss. Certainly then, right, find a provider that feels like a good fit. And then I think stigma, I think that was noted, but right, like just the stigma and what might people think? What do I think? Does this, if I'm walking around with the belief that going to therapy means something about me, right? So I think all of these things can be barriers to.
Yeah.
And I think you asked the question, what can we do to reduce that? I have some ideas, but if I had real answers, I'd probably be doing more of that work. So yeah.
Right. That part. Right. Yeah. Yeah. What about you, Stefan? What do you think are some of the barriers that you see in the work that you're doing with, people asking for help and saying, hey, I need help? Like, I mean, I think people know it, right? But they're just,
So yeah, I totally agree with Dr. Outlaw and Dr. Matlock. It's specifically, coverage and accessibility and time, but therapy is really deeper than that. It's really, you can have your own therapy session within your own car, driving to work in traffic, by paying attention to your thoughts and your programming within yourself to calm yourself, or visualizing yourself making it to work safely, or just giving your nervous system a break. Us as Black people, we're conditioned to go, 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 go. So when we think about time, do I have an hour and a half to give to this person that I don't know that might judge me, when I'm conditioned from birth until my biological age, 18 to 26, to actually, let my nervous system go, which is traumatic on themselves, because we're always in fight or flight, ready to, ready to fight, the combat, and anticipating the worst case scenario, things of that nature. So it really depends upon how much a person is willing to work through themselves and remove the barriers that's preventing them from being their true authentic self. So it's time and accessibility to coverages. Oh, and I want to add that's stress on top of on top of itself, by having, for example, having a job, whatever, and then you have this option between the platinum, the gold, and the silver, and accessibility to have a therapist or a counselor or individual that coaches, in methods to help individuals get past the barriers. Is that accessible for me, or is that going to be affordable for me? But then I have to worry about the copay, and can I afford this? So it's a challenge in itself. So
yeah. Well, Stefan, I want to ask you another thing, just since you're talking about this right now. Like, I think you talked about, having the internal conversation with yourself, but how do you think that, that we can kind of have the conversation where, sorry, I'm lost my train of thought though. What are some ways that we can, make sure that we, with, if we're stressed, like what's a way that we could kind of like help ourselves move past that? Or because I know, is there like anything that you guys do, like for like self-talk and self-care, not self-care but self-talk?
yeah, so basically it's non-attachment and identifying with a negative belief or a thought. So what are beliefs? Beliefs is a habit of thought. You continuously thinking a thought, it turns into a belief or a temperament. So, for example, a client comes into a therapy session. It was like, I had this bad argument with my significant other the other day. Okay, so tell me about it. Well, we didn't agree on such and such or whatever. But you continuously going back to that thought, the brain doesn't know the difference between imagination and reality. So that's engaging in fight or flight. So the brain is releasing a very toxic chemical called cortisol, which is good for you being chased by a mountain lion for 5 minutes. But continuously thinking that thought, it's releasing the cortisol within your body, and it's either causing cancers to your internal organs or a tumor inside your brain. So you have to be conscious to think about, okay, I'm thinking about the argument from last night. So let me continuously, slash that negative thought and put myself in the energy of the person that I want to be. But then that goes back to, give your nervous system a break. Most people are conditioned to live in that trauma, or some people are used to live in drama because trauma feeds drama. So basically, um, just you being conscious and aware of your habitual thinking and making the conscious decision to slash that thought and replace that thought with a thought that's going to place you in the position to where you want to be, and make that your dominant vibration by constantly going back to that. So you're going to have to experience being comfortable, being uncomfortable for a moment, but feel that negative energy, but don't identify with it. You're not going to die. You're not going to vanish or disappear if you feel that energy. And once you feel that energy, then you have the greatest feeling in the world, which is self-reward, because I made it through something I thought that I couldn't make it through. Then your body will become addicted to that.
Right. All right. Thank you for sharing that. Did anyone have anything else to add to that question? Nope. I know. I think you covered it really well. Yeah. Okay. I just want to make sure that we're giving space to people on the call. If you guys have questions, please put them in the chat. We definitely want to save time for questions you may have. But I did also want to just give space right now. I do see some impacted families on the call right now who've lost their loved ones to police. So I did want to just recognize that we have quite a few people on this call. So thank you guys for calling in, and I'm hoping also that you know, we can look towards some of these resources that are there for us to help us with the trauma, right? The trauma and the pain that we have, and also so many other people on the call may not have lost a loved one, but have had trauma in different ways. So, yeah. So there is a question in the audience. So I'll go ahead and ask this and see who would like to answer it. How do you know if you're addicted to pain, drama, and chaos?
I don't want to monopolize things, but I guess I'll jump in there and answer the question. I'd even like to broaden this a bit. How do you know you're addicted to anything, right? And so you can be addicted, of course, the cliche thing is drugs and alcohol, but there's also people who are addicted to retail therapy, right? That sounds very nice, but in essence, people get into real trouble by spending a bunch of money to feel better about themselves. People get addicted to relationships, right? I think we all know someone who bounces from relationship to relationship. And in essence, part of what they're experiencing is they're looking to feel good. They're looking for that beginning honeymoon stage of a relationship where everyone talks about how great of a person you are, and they're looking for that over and over again. Or it can be a little bit deeper than that as well, with sometimes men and women both get in that habit of just really falling victim to the normalization of having multiple relationships. And if this person isn't compliant with what I need, I'm going to go to this relationship. There's many forms of addiction. So we want to, first of all, conceptualize it like that. But in reference to pain and bad relationships, you got to look at what your up is like. Everyone's upbringing, their normal is much different. For example, I didn't come from a household where my parents screamed and yelled and punched holes in walls, but many people do come from those types of households. And don't get me wrong, just because my parents didn't yell, it doesn't mean that things were perfect. And in essence, I was missing some of the emotional connection that some other people may have gotten. So I think we have to answer that question. We got to look at kind of what was our upbringing like, right? And do we find ourselves gravitating to quote unquote drama, right? Because a lot of times what will happen is we get comfortable in uncomfortable situations. We know how to deal with people who, curse at us and slap us and so forth. You can know exactly how to navigate in that world. You know what to expect. You know how to meet that person's needs. But the moment you get into a relationship where someone is attentive, someone is emotionally intelligent, someone is supportive, many times we shoot ourselves in the foot because we don't know how to navigate in that world, right? And so once again, that goes back to kind of what your upbringing is like and what your normal was. I would love for everybody to have a positive experience with relationships, a positive sort of impact on others, but that's not realistic. So unfortunately, we all come from different places. And so just to briefly address a specific question to the person who asked that question, determine kind of what your upbringing was, and are you gravitating toward contentiousness, or are you gravitating towards something else? And so that's kind of a start in terms of kind of understanding where you might be.
Okay, thank you for answering that. I do want to ask maybe Dr. Madlock, if you have any advice or like resources for BIPOC community members, like if there's something that you're saying like is a great resource for someone who needs, you know, some extra help.
Sure, I would say it depends on, I'm going to give the classic therapist answer, it depends. But some that come to mind, like off top of my head, like books and resources, and my mind immediately just kind of like attached to the last question and response that were given. There are a couple of books by a therapist out of Charlotte, North Carolina, Nedra Tawwab, I think is how you say her last name. But she wrote Set Boundaries, Find Peace. And then Drama Free, Drama No More, I believe. And I can look it up very quickly and drop the links for those. And so if you find yourself being challenged interpersonally, that's within some of your relationships, thank you so much, Patty, for putting that in the chat. These can be good ways to start to find, as she says, some peace, some balance, some boundaries within relationships. She gives credence to, she's a Black woman, but she gives credence to how what this might look like culturally, certainly more from her perspective as a Black woman, but she does acknowledge that. I think a book about coming back to self and navigating a wide range of traumas, but through a multicultural lens, is the book Homecoming. Do I have it? I have it right here, so I'll actually show it to you for folks who are visual. It's Homecoming by Dr. Tama Bryant. So I'm a fan of her. She's a clinical psychologist as well, but Homecoming. And the principle here is about really finding our way back to self, whether it's through more like spiritual practices, whether it's through things like grounding and meditation. Thank you so much again, Patty. And really how we tend to lose our way and lose ourself through lived experiences that we could define as traumatic, in ways that we can really just come back home, right? Which is centered on self.
Yeah, thank you. Thank you. And thanks for those resources. I think they're really helpful. It's nice to see visual ones as well and books that we can go back to. So, Stefan, do you have any as well that you resources or things that you find helpful? I mean, you gave us some really good resources of just how to deal with yourself, and but if there's any others.
Was that for me or somebody else?
Oh, I was saying, yeah, I don't know if you had anything to add to that, like other resources that you thought were good. That's for you, Stefan.
Oh yeah. So my approach is more so on a holistic standpoint. So grounding, holistic work, meditation, red light therapy, is going out in nature, shadow work, really going inside yourself and actually feeling, the trauma or the pain that you accumulated over time. Seeing yourself as worthy of being the best version of yourself. Affirmations, mirror work, speaking into the mirror and creating things for yourself, like journaling. All these things are cost efficient and sometimes, like free, but they can really help you, if you're not ready to speak to an individual or want a stranger knowing your dark past, basically, and judging you. If you're a fearful or avoiding individual, you can start with some of those things to actually help yourself. Some of the books, I have a foggy mind right now, but I will add some into the chat right now. You
That
guys
sounds
can.
good.
Okay.
Cool. Thank you. Thank you so much. Oh, go ahead, Lauren.
Yeah,
Dr.
so
Lauren.
sorry, really quickly.
No, it's good.
Community, right? Social support. So important. Again, we've kind of talked about, right, the tendency to isolate when we feel down or overwhelmed, anxious, whatever. But connection and community with safe, trusted people. And it does not have to be to spill everything, to like, right, process, but this idea of staying connected is deeply valuable and really, really important. So I just wanted to add that in.
Yeah, no, and I'm so glad you did because we have Love Not Blood. They're one of the organizations, and also the Oscar Grant Foundation, who really gives a lot to our impacted families. And Love Not Blood has like events for families, and they have like they create community so we can have that space. So I know that we have Uncle Bobby Cephas on the line here, and we also have Wanda Johnson on here. So I just wanted to give a plug to them because they really are doing the work there too. Creating that community is so important. So yeah, then thank you. And also, Stefan, when you mentioned like positive affirmations, that's so important, right? The things we tell ourselves, the things we say to ourselves is so important because when Miles was killed, it's like you could think of all the things you should have done, right? These should have been this way, should have been that way. But, you have to have positive self-talk because it just makes things so much easier to maneuver life.
Yes, it is very
Yeah.
so. The body is 70% water, and the water is the greatest conducer. It holds everything. So how you feel and what comes out your mouth, it sticks to your body. So you have to be very, conscious of the words you speak and the thoughts that you entertain. So affirmations are very, very powerful. They're cymatic. So you speaking, positive affirmations or words over yourself prior to you going out and to the world
Right.
can actually, help lessen some of the stress and some of the anxiety that stems from either, childhood or a bad marriage or, etc.
Right.
So you want to be very mindful and key of how you think and what comes out your mouth. So
Absolutely. No, thank you. I am curious though, how do you think we can advocate for mental illness? Like how can we like reduce the stigma of mental illness? Is there any thoughts on that? I mean, I
I
know
would
having
say
this conversation, right, is important, right? This is the first step.
correct. Talking about mental health is a big piece. So there was a time not too long ago where, to even be talking about or thinking about mental health, one would consider that the other person had to be crazy, right? Like, and that was a word that was used to describe really anyone who sought mental health treatment at all. So certainly venues like this, talking about mental health, talking about solutions to mental health, I personally talk about mental health as much as I can, just because the more you talk about it, the more it becomes desensitized of a topic and people feel a little bit more comfortable talking about it. Once again, I feel like we have made a good amount of progress. We got a lot left, but it's, there are, stars and people in the community who are advocating for mental health resources and putting money down and starting foundations and so forth. So I think that's a start. Certainly, I want to say this at the individual level. So if you have someone who's experiencing yourself or someone else in your family or a friend who's experiencing a mental health sort of crisis, advocate for them, meaning try to do your best to get on the release of information and let that therapist office or that therapist know that you're going to have questions. You want to have some check-ins. You want to make sure that the therapist isn't just taking that client for granted, which does happen. So the advocacy thing can happen at the individual level as well as a broad sort of level as well. But anytime anyone's posting something, a mental health article, I post things on LinkedIn all the time just about mental health in general, and people share. And so those are certainly some easy ways to advocate.
That's great. Thank you. I did want to, we have 5 minutes left, so I just want to see if there's any other people who have questions. Oh, it looks like BJ does have something here. From our panelist experience working with so many different clients, what seems to be the practices that you've heard from your clients is that leads towards healing or a breakthrough when dealing with an unexpected death? No. Well, think about that for a second. But I did want to I have one more question for you guys too. And then that is also just why language is so important, right? Like instead of saying someone's crazy or like, you know, he lost his mind or like, you know, just things like how do you guys, what are your recommendations for that? Like, it's like kind of self-care, right? But self-care in the way that we speak. I don't know, Dr. Madlock, did you, or Stephon?
Can you repeat it? Sorry.
Yeah. Okay, could you give that
Oh
to me?
yeah. Yeah. No, I was saying, why is language so important, right? In the way we talk about people who have mental illness, right? Because people, the crazy is very common, right? And I know a lot of people are trying to move away from that kind of dialogue and conversation with people. So
Yeah, I think similar to what was stated earlier, right? Words do matter. They hold meaning. You know, it's interesting because even in, I want to be clear, this is right, one woman's one therapist perspective. Like even when diagnosing, right? So if I'm with a client and we're talking about their clinical diagnosis, that can be it's deeply meaningful information, and it can be incredibly helpful for any number of reasons. Certainly, right, just for both of us to understand what's happening, what some symptoms might mean to help inform treatment. And then I think there's, right, a limitation to that. I think even things like labels and diagnoses are helpful up into a point. It's in the sense that like one can experience depression or be depressed, but like that's not the essence of who they are. And so I think it's really important that we are thoughtful and careful about the language that we use. Certainly anything that is, I think that can also be used to put someone down or is used pejoratively, we probably want to move away from, right, overusing. So this idea of like being crazy or something being crazy, right? Can we find a better way to describe it or use it? And that is simply to reduce stigma. But yeah, I tend to be like very careful about the overuse of labels in general. Yeah.
yeah, no, for sure.
Right.
And I know, oh, sorry. And I see that Miss Friday, Denise, mother of Colby Friday, thanks for being on tonight. She said there's many different illnesses, right? Well, like you said, words matter. They really do. So, but I want to thank you guys for being on the call. We literally have like 1 minute, so I don't want to keep you guys over. But I did want to just again thank you all for being on this call tonight, taking time out to as we celebrate BIPOC Awareness Month, and also breaking the stigma in mental health and how important it is that we support our family members, we support ourselves, right? I've had so many people tell me, you know, everyone should be going to therapy, right? Like everyone should go. Like it doesn't matter if you had trauma or but just someone to talk through things in your life and what's going on. It's so important. So we do have a 12-week program that we're actually in session right now. Dr. Medlock's in it right now. We're going to be doing one again towards the end of the year. So if you guys now are all registered here, you will all receive an email. So you guys will be on our database. So when we have our next one, you can sign up. But it is limited, right? It is to 12 people. So but I just, again, I want to make sure we say the names of the people who are on this call who have lost their loved ones. So do you want to go ahead and unmute, please? I see several families, sisters on here. I see Jennifer, Leon. So I'll start. Miles Hall. Say his name, Miles Hall.
Miles Hall.
Miles Hall.
Miles
Miles Hall.
Miles Hall.
Miles Hall.
And I see we have
Miles
Oscar
Hall.
Grant. Let's say Oscar Grant.
Oscar Grant. Oscar Grant.
Oscar Grant.
Oscar Grant.
We have Alan Bluford. Say his name.
Alan Bluford.
Say Latimer Abaleta.
Latimer
Abaleta.
Say Stephen Taylor.
Stephen
Taylor.
Taylor.
Angelo Quinto.
Angelo Quinto.
Angelo Quinto.
Angelo Quinto.
Kelly Zachary.
Kelly
Zachary.
Zachary.
Sonia Massey.
Tanya Massey.
Brian Gaynor.
And Ryan.
Ryan Gaynor.
I also
think-
see we have Lorenzo Cruz.
Yes,
His name.
Lorenzo Cruz.
Lorenzo Cruz.
There's a lot, you guys. It's awful to be
Did
in
we
this
say
club.
Kobe Friday? Kobe Friday.
Say it's
Kobe Friday.
Kobe
Friday.
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 Every Friday.
And I know we have Erica on here. Erica, do you want to say your loved one's name? Nope, that's okay. Well, thank you guys all for being on this call. We will also provide additional resources. So just to make sure that if you do need to see somebody, and you want to make sure that you have, the right resources. Also, remember that 988 is also a resource now. It's called in California, it's called the Miles Hall Lifeline and Suicide Prevention Act. And then that you'll have a trained person on the other line who can help you, and so you're not necessarily, reaching out to law enforcement. All right, thank you guys all again. I want to give another big shout out to Dr. Outlaw, to Dr. Madlock, and of course to Stefan. You guys are really great, and it was so nice to have you on. I know there was a couple other questions in here, so we'll try to capture those and reach out to you individually if you had something else that we didn't answer.
Thank you.
All right,
Thank you, Tom.
bye, you guys. Thank you. Have a good night.
Bye. Thank you.
Thank you.